How do new blood tests help dementia diagnosis? Imagine being able to get a clearer picture of what's happening inside the brain without invasive procedures. That's exactly what new blood tests are starting to do for diagnosing dementia, especially Alzheimer's disease. These tests, like the FDA-approved Lumipulse test, analyze specific proteins in the blood that are linked to brain changes. The main proteins they look for are beta-amyloid and tau. These proteins tend to build up abnormally in the brain years before any symptoms show up. By measuring the levels and ratios of these proteins in the blood, doctors can get clues about whether memory problems might be caused by Alzheimer's disease. In the past, diagnosing Alzheimer's often meant expensive and invasive procedures. Brain scans, called positron emission tomography scans, could detect amyloid plaques, but they are costly and not always easy to access. Lumbar punctures or spinal taps could also measure these proteins directly from cerebrospinal fluid, but they can be uncomfortable and requiring specialized facilities. Now, with a simple blood draw, healthcare providers can quickly gather important information. This makes screening more accessible and less stressful for patients, especially those showing early signs of memory loss or cognitive decline. Early detection is vital because it allows for earlier treatment. While current medications can't cure Alzheimer's, they can slow the progression if started early enough. Blood tests help identify those who are most likely to have Alzheimer's, so treatments can be tailored more effectively. They also help doctors distinguish Alzheimer's from other causes of dementia, like strokes or Parkinson's disease, which can sometimes look similar but requiring different approaches. This helps ensure patients receive the right care and support. Another benefit of these blood tests is that they can speed up the process of finding suitable participants for clinical trials. Faster recruitment means researchers can develop and test new treatments more efficiently, bringing hope for better options in the future. It's important to remember that these blood tests are not meant to replace a full clinical evaluation. They are part of a comprehensive assessment that includes medical history, physical exams, cognitive testing, and other investigations. Because memory loss can be caused by many different factors, such as depression, high blood pressure, or diabetes, a healthcare professional's interpretation remains essential. In summary, new blood tests are helping improve dementia diagnosis by providing a simple, quick, and less invasive way to detect brain changes associated with Alzheimer's. They support earlier diagnosis and treatment, help differentiate between different causes of cognitive decline, and assist in advancing research. These advances are promising steps toward better care for those experiencing memory issues. Still, always consult a healthcare professional for personalized advice and to understand what these tests mean for individual health.